Have you ever tried giving someone directions without, a map or a landmark? It's pretty much impossible, right? Just total chaos. Well, the human body is this incredibly complex landscape, and to navigate it, everyone from doctors to physical therapists needs a shared language. Think of it like a universal GPS. So let's dive in and learn how to use it.
Seriously, think about this for a second. If you have a pain in your leg, how do you tell a doctor exactly where it is? Is it on the front, the back, the side, above the knee, below the knee? See? It gets messy really, really fast. And this is the exact problem that the language of anatomy was created to solve.
Before any map or GPS can work, you absolutely have to agree on which way is north. It's the one thing everything else is based on. Well, anatomy is no different. We need a single, universal starting point that everybody on the planet agrees on. It's our true north for the human body.
And here it is. This is the anatomical position. Now, it might look a little stiff, maybe a bit unnatural, but this is it. This is our true north. The body is standing straight up, feet are just a little bit apart, and this is the key part. The palms are facing forward with the thumbs pointing out. Every single term we're about to go over is based on the body being in this exact position. It doesn't matter if you're lying down or standing on your head. In anatomy, all directions refer back to this.
Of course, in the real world, people aren't always standing like that. So in a medical setting, you're going to hear terms like supine, which just means lying on your back, or prone, which is lying on your stomach. But, and this is important, even when someone is in one of these positions, all those directional terms we use still pretend the body is back in that original anatomical position.
All right, so we've got our starting point, our true north. Now we can start building out the rest of the map. These are basically the cardinal directions, the north, south, east, and west of the body. With these, we can describe the location of anything in relation to something else with perfect clarity. No more confusion.
First up, we've got anterior and posterior. Honestly, just think front and back. It's that simple. Your kneecaps are on the anterior side of your leg, your shoulder blades are on the posterior side of your body. It's like the front bumper and the back bumper of a car.
Next, we need our up and down. That's where superior and inferior come in. Superior means toward the head, and inferior means away from the head, or toward the feet. So, your nose is superior to your mouth, and your stomach is inferior to your heart. It's just a simple vertical line.
Now I want you to imagine a perfectly straight line running right down the center of your body, from your head to your toes. Anything that's closer to that line is medial. Anything that's farther away from it is lateral. So your nose is medial to your eyes, but your ears are lateral to your nose. Makes sense, right? Okay, this pair, proximal and distal, we mainly use these for the arms and legs. Proximal means closer to where the limb attaches to the main trunk of your body. Distal means farther away. A good way to remember it is that proximal is in closer proximity to the body's core.
All right, let's do a quick check-in. Time for a pop quiz. Based on what we just covered, take a look at your arm. Is your elbow proximal or distal to your wrist? Think about which one is closer to your shoulder.
And the answer is proximal. Your elbow is proximal to your wrist because it's closer to your shoulder, which is the attachment point for your whole arm. That means your wrist is distal to your elbow. See? You got this.
Now, while all those terms work for pretty much the whole body, the hands and feet are a little special. They get their own unique names. For the palm side of the hand, we say the palmar aspect. For the sole of your foot, it's the plantar aspect. And for the top of your foot or the back of your hand, it's the dorsal aspect.
Okay, so we've got the outside of the body all mapped out. But what about the inside? How do we talk about what's going on in there? Well, for things like CT scans or MRIs, we have to imagine slicing through the body with these big, imaginary flat surfaces. We call these the anatomical planes.
And there are three main ones you gotta know. First, the sagittal plane. This is a vertical cut that divides the body into left and right parts. Second, the coronal or frontal plane. This one's also vertical, but it divides the body into front and back sections. And third, the axial plane, which is a horizontal cut, like a magician sawing someone in half, dividing the body into top and bottom parts.
Oh, and a quick little side note here. If that sagittal plane slices perfectly down the midline, creating two equal mirror image halves, well, that gets a special name. We call that the median, or mid-sagittal plane. So far, everything we've talked about has been for a static, unmoving body. But we all know bodies move. So, of course, anatomy has a whole set of words just for describing motion. This is where our GPS goes from being a static map to a real-time, moving animation. Let's start with the most basic pair, flexion and extension. Flexion is just bending a joint, which decreases the angle. Think about doing a bicep curl. You're flexing your elbow. Extension is the exact opposite. It's straightening that joint back out, increasing the angle.
Hey, remember medial and lateral? Well, this is just the movement version of that. Abduction is when you move an arm or leg away from the midline of your body, like when you raise your arm out to your side. Adduction is when you bring it back in, you're adding it back to the body.
Now for the forearm, we have supination and pronation, and there's a really easy trick to remember this one. For supination, your palm is facing up like you're holding a bowl of soup. Get it? Supination, soup. For pronation, you turn your palm down and, well, you pour the soup out. You'll never forget it now.
Okay, so why does any of this really matter in the real world? Well, let's look at a perfect example where this language is absolutely critical every single day: medical imaging. Let's talk about X-rays.
When you get an X-ray, they talk about the projection. And all that term means is the path the X-ray beam takes as it travels through your body. The name of the projection is simply based on where the beam enters and where it exits, using the exact same directional terms we've just been learning.
And this is where it all clicks into place. Look at this. An AP projection just means the beam enters the anterior side and exits the posterior. A PA view? Just the opposite. A dorsipalmar view of the hand? The beam goes in the dorsal side, the back, and out the palmar side. It's not some crazy secret code, it's just a combination of the words we already know.
And there you have it. It's pretty cool, right? In just the last few minutes, you've basically learned the fundamentals of a whole new language. You now have the core system, the GPS coordinates, to navigate the human body with precision.
So the next time you hear a doctor on a TV show, or read a fitness article, or even just think about your own body and how it moves, listen closely. You're now equipped with this new way of seeing things. You speak the language. So what do you see differently?